The steps of CPR. The early recognition of an emergency and swift help typically results in a better outcome for the victim. Early CPR is the best treatment for cardiac arrest until EMS and an AED arrive. The following are the steps of CPR. Scene safety. Establish unresponsiveness. Activate 911 and get the AED. Check for breathing. Start CPR if needed. Now, let's discuss each step individually. Scene safety. Scene safety is your #1 priority when approaching a situation. As you are approaching the incident, take a look at the surrounding environment to make sure you and others will be safe. Look for hazards like electrical, gases, traffic, falling objects, or any potential problem. You can't help if you get hurt too. Sometimes the best thing you can do is to stand back. Establish unresponsiveness. Gently tap the victim's shoulders and say, "Are you okay? Are you okay?" to see if they respond. Someone who is responsive might open their eyes, move, speak, or react when you tap on their shoulders and ask if they are okay. Someone that does not react, open their eyes, move, or speak is unresponsive. Activate 911 and get the AED. The quicker you call 911, the greater the survival rate of the victim. When asking someone to call 911 and get the AED, make sure you point at them, look them in the eyes and say, "You call 911 and get the AED," so that they know you are asking them to make the call.
Gabe, call 911 and get the AED.
If you're alone and don't have a phone, immediately leave the victim to call 911 and get an AED if available. For child and infant CPR, perform 2 minutes of CPR compressions before you leave to call 911. It's okay to use a landline or a cell phone. Turn on speaker mode and lay the phone next to you and the victim. This way, you can assess the victim while on the phone with the dispatcher. If there is no AED available, do not delay the start of CPR. When calling 911, be prepared to tell the dispatcher what the emergency is, your location, and what has happened. Stay on the phone until the dispatcher tells you to hang up. They can instruct you on how to do CPR, use the AED, or provide first aid treatments. Be calm, speak loudly and clearly. Next, check breathing. Observe and scan the victim by looking for breathing or movement. Do this for a minimum of 5 to 10 seconds. If the victim is breathing, then their heart is working and no CPR is needed. If the victim is breathing and no accident or injury has occurred, you can roll the victim onto their side. This is called the recovery position. To roll the victim, extend one of the person's arms above the head and roll the body to the side so that the person's head rests on the extended arm. Once the person is on his or her side, bend the top leg towards you to stabilize the body. At this point, you would start your first aid procedures. Monitor the victim, making sure they continue to breathe until EMS arrives. If the victim is not breathing, start CPR. If it appears the victim has an occasional gasp or snore, this may be agonal respirations. Agonal respirations are an abnormal pattern of breathing which may appear to be an occasional gasp, snore, or groan. Agonal gasps usually occur in the first minutes after cardiac arrest. These gasps are not effective breaths. This should be treated as not breathing. Remember scene safety when approaching an emergency. You should always avoid moving a person involved in an accident, as you could cause further injury. One of the exceptions of moving a person involved in an accident is if you have to move them onto a hard, flat surface to perform CPR. If you must move a person, be sure to support their head, neck, and body in a straight line so that they do not twist, bend, or turn in any direction. It's best to use 2 to 3 people to do this. The victim will need to be rolled on their back on a hard, flat surface before CPR can be performed in any scenario. Do not attempt CPR with a victim lying on a bed, couch, or in the water. Chest compressions. Chest compressions are one of the most important parts of CPR. CPR can be performed on all people, including someone who is pregnant. A chest compression is the act of pushing down on the chest, forcing oxygenated blood to the brain, keeping it alive until advance help arrives. You are manually making the heart pump because it's not pumping on its own. First, remove clothing from the chest to visualize proper hand position and AED pad placement. Place the heel of one hand in the center of the chest over the lower half of the breastbone and place the other hand on top of the first. Your shoulders should be straight over your hands and your elbows fully extended and locked into position. Now you are ready for compressions. These compressions need to be fast, hard, and deep enough. It's important to allow the chest to return to its normal position after each compression. CPR compressions should not be interrupted for more than 10 seconds. You need to push hard to a depth of at least 2 inches for adults, approximately 2 inches for children, and about 1.5 inches for infants. The compression rate, or speed, is 100 to 120 compressions per minute for all persons. Release the pressure completely after each compression, allowing the chest to return to its normal position. This will allow the heart to refill with blood. You should compress and release in a smooth and regular steady rhythm, making sure you do not bounce, rock, or bend your elbows. Allow your body to do the work, not your arms. You will provide 30 compressions, then open the airway and provide 2 breaths. Giving breaths. Giving breaths is especially important for anyone in cardiac arrest due to a respiratory issue, a drowning, drug overdose, or any incident or illness that caused the person to stop breathing. Before giving breath, you will need to open the airway using the head tilt chin lift method. Place one hand on the forehead and the other hand on the bony part of the chin. Tilt the head back while lifting the chin to open the airway. While unconscious, the tongue is relaxed at the back of the throat and can block the airway. By lifting the chin, you are pulling the tongue from the back of the throat, opening the airway. While holding the airway open, use the hand on the forehead to pinch the victim's nose closed with your thumb and forefinger. Take a normal breath. Place your mouth over their mouth, making sure you have a tight seal so no air escapes from the sides. Provide 2 breaths. Give 1 breath, take your mouth off, take a breath, and then give the second breath. Each breath should be no longer than 1 second each. While administering breaths to the victim, look towards their chest to see if it rises. This is how we know air is going into the lungs. If the breath doesn't make the chest rise, allow the head to go back to its normal position. Then, open the airway again by using the head tilt chin lift method and give another breath, making sure the chest rises. Follow the 2 breaths with 30 compressions. Now let's put it all together. Here are the steps necessary to perform CPR on an adult. An adult is someone who has gone through puberty. Always consider using personal protective equipment. Scene safety. Ensure the scene is safe. Establish unresponsiveness by gently tapping and shouting, "Are you okay?" If unresponsive, have someone call 911 and get an AED. Check for breathing. Observe for breathing or gasping. Check for 5 to 10 seconds. If the victim is not breathing, start CPR. Bare the victim's chest. Place hands on the lower half of the breastbone center of the chest. Start compressions. Compress the chest at least 2 inches at a rate of 100 to 120 compressions per minute. Let the chest return to normal position. Compress 30 times, making sure your compressions are fast, hard, and deep. After 30 compressions, open the airway by using the head tilt chin lift method, making sure the jawline is perpendicular to the ground. Then, give 2 breaths. Place a mask barrier over the victim's mouth with the airway completely open and give 2 breaths that are 1 second each. Make sure you have a tight seal so no air escapes from the sides. While giving breaths, look towards the chest to see if the chest rises. Continue to perform 30 compressions, followed by 2 breaths until EMS arrives, an AED arrives, or the victim shows signs of life. Once an AED arrives, immediately place it into operation.
Wake up, are you okay? Are you okay? Gabe, call 911 and get the AED.
Okay.
Not breathing. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28,
Here's
29,
your AD.
30.
911's on the way.
Thank you.